Update on tongue tie. Some of you will have seen my earlier DVD with detailed coverage of anterior and posterior tongue tie in babies, children, and adults. I even took great delight in finding cases of animals who suffered low weight gain from tongue tie. Study and treatment of tongue tie continues to evolve, so I would like to add a few points. There is concern of posterior releases reattaching quite frequently. Another is whether we are clipping too many frenula, and perhaps we should look for other solutions in some cases, particularly the case of posterior tongue tie. Are we releasing too many frenula? My experience with anterior frenotomy is that there is a very clear benefit and rarely any concerns following the procedure. Posterior frenotomy also usually improves latch, but some parents are reluctant knowing that sublingual tissue is entered. The most difficult aspect is that they will all reattach without diligent aftercare by the parents. The most common method of preventing this where I live is sweeping under the tongue with the fingertip repeatedly. These will invariably reattach. Another is rubbing firmly back and forth under the tongue. Literally every clinic day, I see completely reattached tongue ties with these methods. I have seen babies clipped up to 4 times. If the frenotomy was done within 3 weeks, I will usually do a blunt dissection, one firm push. The method I have had most success with is one very firm push on the wound with the index finger. Continuing the backward push, one also stretches the tongue upwards. This should take only 3 seconds once the parents have become confident. This should be done 3 or 4 times a day for about 3 weeks. Before clipping, I recommend that the practitioner ask the parents to feel the tongue tie. This helps them understand the anatomy, and it helps you assess whether the parents will be able to follow instruction. It will be wise to have an appointment at 1 or 2 weeks to recheck and do a blunt dissection if necessary. Before doing a posterior release, I explain to the parents that I do a clip and then a very hard push backwards under the tongue to fully release the tongue tie. I prefer it if they watch the procedure. I also demonstrate the force of that push on their arms beforehand to ensure that they are aware of what is required afterwards. If you or the parents believe the follow-up care will be too difficult for parents to succeed, I would suggest delaying frenotomy and trying an appropriately sized nipple shield if necessary, or even pumping for a period. Always remember, there may be more subtle adjustments you can make to the position and latch.